The beginning of the inflammatory cascade starts with the release of arachidonic acid from the cell membrane. Arachidonic acid is an omega-6 fatty acid that is part of the phospholipids, which are a component of the cell membrane. The release of arachidonic acid from the cell membrane is catalyzed by phospholipase A2 and is the first step in a series of steps that produce eicosanoids. Arachidonic acid can be metabolized by either cyclooxygenase, COX, or lipoxygenase, LOX. If arachidonic acid is metabolized by COX, pro-inflammatory eicosanoids, prostaglandins, prostacyclins, and thromboxanes are produced. These prostaglandins are inflammatory and produce a variety of effects, including increased blood flow through vasodilation, vascular permeability. Remember, this is vessel leakiness. It allows the cells and chemical mediators to get from the bloodstream to the site of injury. Erythema, which is redness, and chemotaxis. This is an attraction of inflammatory cells and an increase in the pain response. These are mostly the effects from prostaglandins and prostacyclins. Thromboxanes stimulate platelet aggregation, and this is clotting. This is everything we see from an inflammatory response after injury. Clotting to stop the bleeding, and redness and swelling. Now, if arachidonic acid is metabolized through lipoxygenase pathway, leukotrienes are produced. Leukotrienes also vasodilate by increasing blood flow. They increase vascular permeability, in addition to attracting inflammatory cells, which is chemotaxis. So this sustains the inflammatory response. If omega-3 fatty acids are incorporated into the cell membrane, specifically EPA, they can be metabolized by cyclooxygenase or lipoxygenase, but they produce anti-inflammatory eicosanoids. Omega-3 and omega-6 fatty acids will compete for the enzymes cyclooxygenase and lipoxygenase. When omega-6 fatty acids are metabolized, they produce pro-inflammatory and pro-thrombogenic, which is pro-clotting, eicosanoids. When omega-3 fatty acids are metabolized, they produce anti-inflammatory and anti-thrombogenic eicosanoids. I'm not concerned that you know the individual names and numbers of the prostaglandins, leukotrienes, or thromboxanes. The role of diet. Going back to the discussion of the competing pathways for COX, we know that certain foods will increase the incorporation of omega-3 fatty acids into the cell membranes and increase the production of anti-inflammatory eicosanoids. A diet high in omega-3 fatty acids will reduce inflammation, and this includes a diet with such foods as fatty fish, walnuts, and flax seeds. Saturated fats are considered pro-inflammatory, are found in processed foods and meats such as beef, when lean cuts are not selected. Trans fats are in processed foods and found in processed packaged foods. High glycemic index foods, such as refined carbohydrates and crackers, cookies, refined breads, and bagels, are also considered to be pro-inflammatory. Alcohol should be consumed in moderation, and weight should be maintained. Red wine with resveratrol may decrease inflammation when consumed in moderate amounts. So moderation is the key. Foods that are high in arginine, such as eggs and nuts, may also help decrease inflammation. A high volume of vegetables with vitamin C, magnesium, and antioxidants are considered anti-inflammatory. The use of garlic, curcumin, ginger tea, ginger, cinnamon are all anti-inflammatory.